Tibial nerve entrapment. Tibial nerve entrapment occurs at any age, but is seen in females more often than males. The approximate occurrence is unknown, but is overall uncommon. It's seen in patients with a past medical history of tumors, rheumatoid arthritis, edema, arthritis, and trauma, specifically with fractures of the tibia, calcaneus, and metatarsals, and among ankle sprains. And it's also seen in patients who have poorly fitted footwear. So during the subjective portion of the exam, patients may report feeling a burning sensation, numbness, and tingling along the medial side of their ankle and/or plantar side of the foot. They may also report pain in their foot that radiates down to their toes, with the big toe being the most common. And the onset of symptoms is typically slow with an insidious onset. So in this case example, we have a 60-year-old female who's experiencing pain on the medial side of her ankle and foot. And in this video, you'll see the specific types of questions one might want to inquire about if they begin to suspect tibial nerve entrapment.
All right, hi, my name is Anthony. I'm your physical therapist today. Nice to meet you. So what brings you in?
I'm coming in because I've been having some foot and ankle pain and discomfort.
Okay.
Weird feelings.
Can you describe it for me? What it feels like?
Yeah, it's I don't know, it's just always tingling, and it feels kind of numb even to touch. Even sometimes burning. It's all on the middle of my ankle and the bottom of my foot, towards my big toe.
Okay, so just right there on the inside, and it kind of travels and you say radiates down the foot and all the way to the big toe?
Yeah, it just feels all numb, tingly there.
Okay. And then if you were to rate that pain on a scale of 0 to 10 right now, what would you say? How would you rate it if it's present?
Right now, probably just a 3. Not too bad.
Okay. And then, let's say in the last couple of days, what was the worst it's been?
Probably it gets really bad sometimes. It's when I get that burning sensation, it gets almost to a 7.
Oh, okay.
Yeah, it gets really high.
Okay.
Very uncomfortable.
And then what's the best that it's been since then?
Sometimes it gets down to maybe a 1.
Okay, so it can get pretty aggravated and irritated.
Yeah.
Okay. Is there anything that you noticed? Well, first off, how long has this pain been going on? Before I ask that question.
It started maybe a year ago. I noticed it a little bit, but it's just been getting progressively worse, and it's pretty bothersome now, which is why I came to get it checked out.
Okay. And then prior to a year ago, you never really experienced anything like this before?
No, that's when I really started noticing it. It's a year ago.
Okay.
Yeah.
And it just got worse and worse and worse over time. Okay. Well, now on to my next question. Is there anything that makes that pain better that you've noticed?
I don't know. I mean, I noticed that when I'm wearing specific shoes, it definitely makes it worse. But other than that, I guess just resting makes it feel better.
Okay. So certain footwear you notice can either make it better or worse.
Yeah.
Okay. Is there any sort of past medical history I should be aware about?
I mean, I did fracture my ankle a while back.
The same foot, I'm assuming?
I think it was in 1976. I was playing basketball.
Okay.
Broke my ankle, but now it's totally good. But that's the only medical history relating to my ankle that I can think of.
Okay. Anything else? No? Okay.
No.
So if you don't mind me asking, do you do anything for a living?
I used to. I was a nurse, but now I'm retired. So I spend my days with my grandchildren, and just working around the house. Pretty laid back.
Okay. Yeah, I'm a nurse, so a lot of walking, a lot of on your feet then.
Yeah.
All right. Well,
a lot of years of that.
But you're retired now.
Yes.
Nice. Very nice. Enjoying the life. Yeah. All right. Well, before we move on, I just have a list of questions. I just want to ask real quick. Have you been experiencing any bladder or bowel dysfunction?
No, not really.
No? Okay. Any sort of night sweats, night pain?
Nope.
Fever?
Nope.
Okay. So we'll go ahead and move on to the objective in just a moment.
Okay. Right. Sounds good.
So during the objective portion of the exam, the therapist might notice strength deficits, likely weakness in the ankle, foot, and/or toes, more specifically They may notice the patient's inability to curl their toes all the way, and they may also notice weak plantar flexion and or weak inversion. And there may also be a positive Tinel's sign if the Tinel's test is administered. And they may also notice atrophy of intrinsic foot muscles compared to the unaffected side during the observation. So in this video, these specific objective features are demonstrated to show the possible findings one might come across during this part of the exam.
All right, so now we're going to move on to the examination and objective part of this evaluation assessment. So the first thing I'd like to see you do, we'll start off with your left side, the unaffected side. If you don't mind trying to curl your toes like you're trying to pick something up with it. Yep, good, good. And then let me see you go ahead and try with your right side. Keep going, keep going. All right.
That's it.
Okay, that's it, okay. Yep, so there is a little bit of a difference compared to the unaffected side with the contraction there. And then I'm gonna go ahead and check out your what's called plantar flexion. So what I want you to do here, I'm gonna hold your foot up a little bit like this and then place my hand here. I want you to push down on my hand like a gas pedal. Try to press down, there you go. Yep, as far as you can. Good, good, good. All right, relax. And I'm going to do the same thing on your affected side. So lift up your foot. I want you to press down as hard as you can. Press, 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 press. There you go, there you go. All right. Again, with the plantar flexion, there is a bit of a difference in strength. It seems like the right side is a bit weaker than the left. And then one of the other things I want to test real quick is what's called inversion of your ankle. And I want you to try and lift your ankle up and to the side a little bit, like that. Yeah, yep. So go ahead and lift it up like that. And then don't let me push you the other way. Don't let me push you the other way. Don't let me push it. There you go. Good, good. Nice strong inversion on that left side. And then same thing over here. So go ahead and don't let me push you. There you go. Hold it, hold. All right. So I don't know if you saw or noticed, but you gave a little bit.
Felt a little
Yeah,
bit on the side.
yeah. There's a little bit of give on that side. All right. So then the next test would be what's called a Tinel's test. And all I'm going to do is just simply tap a specific spot on the inside of your ankle, and you let me know if there's any reproduction of that burning, numbness, tingly pain that you've been experiencing. Okay. Right, so just relax.
Oh yeah, I feel it going in my foot, like on the bottom, like that burning pain
Okay,
that I
so
came in with.
okay, so it's not just here, but it's radiating.
Yeah.
Just like before.
Yeah, it's like the same pain that I
Nothing
always
different or new.
experienced. Yeah.
Okay. Again,
Yeah.
one more time. Okay.
Yeah, definitely feel that.
Okay. And I do also note a little bit of atrophy with your affected side compared to the left as well. So just from observing and watching perform the various tests.
So the mechanism of symptoms are the immune cells releasing inflammatory cytokines, lowering the firing threshold, inducing abnormal firing of mechanosensitive and nociceptive neurons causing pain. And also mild nerve compression can produce inflammation leading to neuropathic pain behavior. So while there's no key diagnostic feature, it is important for therapists to remember that we are able to treat this condition. However, if the condition worsens or does not improve, we need to refer out to a specialist.